Hi, in this video, I want to talk about what I mean when I say know, do, understand, and apply. This is such an important component to how I've always taught medical assisting, and it's also a component to why we've had such successful medical assistants that get out there and just really rock it at their jobs. So let me explain. To know means we need to gather information, and this part would be you need to be doing reading and taking notes and what I call cue cards for procedure lists that help you to really go over the procedures and get to know them. So that's know. The next is do. And do means to take all of this information that you've taken in your reading and your notes and your cue cards and really start to practice the information, the skills, working. Let me give you an example. Vitals. You take vitals, you start early on in your program, typically practicing taking blood pressure, pulse, temperature, and respiration. And the more you do it and the more you practice it, you know it, right? You have the information, you know how to do it, you've studied it. Now you're practicing. But you really need to understand what that information means before you can go out and apply it in your career, in your office, in your externship. And so the understand part comes from the practicing and knowing the whys of why you're doing these things. Why is it important to keep the arm at heart level when you're taking a blood pressure? Why is it important for you to make sure that your patient is not crossing their legs when they're taking the blood pressure? Why is it important that the patient has a moment to kind of relax as they come into the office and get their vitals taken? And why do you maybe need to do those vitals again, either after the doctors come in or 5 minutes later? Why are these things important? So that's the understand part. And once you have done the reading and the notes and made your cue cards, so you know the information, and once you do, which means you're taking in all that information and you're practicing it and you're practicing it and you're putting it into uh, application in your lab at school, you're practicing with your husband at home or your daughter or your dog. You might be practicing with your dog, right? So now you're doing, and that brings you to the understanding. And then it's easily applied. And so when you go out into the world, when you're doing your externship, when you're working for that fabulous doctor, it's here, it's in your brain. It's natural. It's something that you know how to do and you excel at it. And I think that's such an important part of how we need to approach learning medical assisting or any allied health program that you're working on, and truly any information at all that you're working on. So when you hear me say throughout lectures, throughout demonstrations, throughout my procedure videos, know, do, understand, and apply, you know what I'm talking about. Okay, great. I hope you have a wonderful day, and I'll see you. I usually say in class, but I'll see you on YouTube. Bye bye.